Hello, I'm Greg Holloway, and welcome to the Common Sense Texans video debate among the Republican gubernatorial candidates, Rick Perry, Kay Bailey Hutchison, and Deborah Medina. Each of the candidates will be presented with 10 questions that have been prepared by grassroots conservatives around the state. Now let's go to one of these questions right now.
I think that the concept is correct, that we do things in government that we could privatize. One of the things that we could certainly be looking at for privatization would be the contracting out of certain services that could be just as well done in the private sector as the public sector. Contracting out gives private sector jobs. One of the things I thought was the worst about the President Obama's attempted takeover of our healthcare system is that it would turn over 1/6 of our private sector economy to the government. And that would mean pharmacists, it would mean doctors, it would be nurses, it would mean healthcare providers and hospitals would all be government run. That is not what we should be doing. We should be having private sector. For instance, in building highways, it is the private sector that builds highways. Those are private sector jobs. We need to keep as much in the private sector so there can be competition and jobs that are going to be ongoing and supporting our country and our economy, not taking from it. So I just think looking at the places that we can contract out is probably where I would be looking.
Texas currently operates in excess of 140 agencies within our state. All of them, as you read their strategic plans and goals and initiatives, are growing bigger and bigger. There are ample opportunity. I think the thing that has to come to mind first is healthcare. I pointed out already in this interview that the state of Texas spends the biggest bulk of her resources delivering healthcare services. It eats up fully 1/3 of our state budget, and yet nary a one of us would say that that is the #1 job of state government. We must look at where the state of Texas is delivering health care, recognize that it would be more appropriately delivered, more affordably delivered, with better availability and higher quality in the private sector. Individuals take care of themselves first. They look to their families second for basic health care needs. And when individuals and families are unable to meet those needs, they seek assistance in their community from their local physician or other health care providers. That's where health care ought to be being delivered. We need to work aggressively to return health care to the community where it belongs, rather than having the state attempting to provide health care to everyone in Texas. There are other examples almost in every agency where the state is doing things that it ought not be doing. In a republic, in a limited government model, its job is to make sure that there are a fair set of laws and that those laws apply equally to everyone. We'll be relooking at every agency and setting our course differently, charting a different course for Texas, a limited government course, one that really recognizes that this society rests on individuals and families, churches and communities, and the government, and each of us has an important role to play in this free and prosperous society. Texas is going to get out there and get after it again when we have a governor that's courageous enough to say, the government can't help you with that. Return to your home, return to your community. Y'all find the solution. You'll find the solution that works best. Texans will thrive and prosper as a result.
Well, I've been a big proponent of privatization and public-private partnerships, historic ways of where the government had completely and absolutely run those, and then moving to a privatization. Prison systems is one of them. We've seen the privatization of our, we're a law and order state. You break the laws in the state of Texas, if you reach a certain level activity, we're going to lock you away because you don't know how to live in our society. So having the private sector, and we've done that through the years. We've had some private prisons built. We continue to look at ways for the private sector to come in. And I'm a big believer that you know, there are things on the law enforcement side, transportation infrastructure. Historically, that was completely done by the government making the decisions and contracting out to some private sector contractors to build the roads. But as we go into the future, I think having an open-mindedness to allowing the private sector, you bet, you have to have your oversight and you make sure that the private sector is not going to take advantage of our taxpayers. But I can't think of almost anything that is not at least open to having the private sector do it. My bottom line is this: if you can do it efficiently and you can save money for the taxpayers of the state of Texas, let's have that discussion. Let's let the private sector do those jobs that historically government has kind of had a hands-off approach for the private sector doing.